Hello, good afternoon. My name is Dr. Trudy Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to our YouTube Open Clinic with Dr. Trudy. This evening, we're going to talk about diminished ovarian reserve. Diminished ovarian reserve. So, if you have diminished ovarian reserve as a woman, how can you still end up becoming a mother? How can you still end up becoming pregnant if you have diminished ovarian reserve? So we're going to use this guide to help us to understand the concept of DOR, diminished ovarian reserve. So please, when you come in, announce your name, announce your location, make sure you can hear me clearly. My presentation is going to come first. Then after that, you will have an opportunity to ask your questions in real time. Okay, so please, when you come in, just put in a word on the comment section so I will know that you're ready. And if today is the first day of attending the open clinic, my open clinic is every Tuesdays, 6 p.m. Eastern Time, 12 a.m. Nigerian time. Then weekends, it's 12 p.m. Eastern Time US, 6 p.m. Nigerian time. So thank you so much, and let's get started. You see, every woman is given two ovaries, and your ovaries come from when you were born. So once you become a woman and it's confirmed you're going to be a girl, right? You will have two ovaries. Now, inside the ovaries are the eggs, and the eggs are what you will use for your entire reproductive life to have your family. Now, as you're developing from your mom's womb, by the time you're born, you already have the complete eggs you will use to become a mother. But once you go into puberty, those eggs will start going into maturation phase. Then once in a month, you release one egg or two eggs if you're going to have multiple pregnancy. The process of releasing that egg, it's called ovulation. Once you release those eggs, you can retrieve them back. So once you release it, you've already depleted the pole. So women have about thousands when they were inside, but once you get to that puberty age, you have approximately about 400 eggs you will use for the entire reproductive phase to have your family. So your reproductive phase is when you can actually have kids before you go into menopause. Now, in some women, for some reasons, they might notice a sharp decline in the quality and quantity of the eggs. By default, once you get to age 35 as a woman, it's expected that both the quality and the quantity of your eggs will start depleting by default. So the biggest factor in predicting how a woman will be, how soon she will become pregnant, is actually age. So as you're getting old, there are a couple of hormonal changes in your body which will eventually lead to menopause. When you get to menopause, you have exhausted all the available eggs to you. So you have finished ovulating them. You no longer have them. You can still be a mother, but you need to go and borrow someone else to become a mother. So you need to borrow someone else's egg. Now, when you have diminished ovarian reserve, it means which we normally use to know your reserve. Number one is AMH, anti-Mullerian hormone. Number two is FSH, follicular stimulating hormone. Now, the reason why I'm running this clinic today is to dispel that fear about hinging on numbers. Now, be careful. The fact you have diminished ovarian reserve, that means your AMH is low and your FSH is high. The reason why your FSH is going up as you're getting older is because the estrogen is dropping. So by default, when a woman is getting older, the level of estrogen is reducing, the level of FSH is going up, and you will likely start experiencing hot flushes, dry vagina, low libido, mood swings is expected. Now, the fact you have these numbers in a low range doesn't mean that pregnancy is impossible. So the fact you have diminished ovarian reserve, you don't just have to isolate that in numbers. So it's not a death sentence. It doesn't mean you cannot become pregnant. It doesn't mean your partner cannot get you pregnant. It means we have to wake up and investigate further. There are so many factors that can affect the fertility in a woman. There are so many factors that can affect the fertility in a man. So once you have that number, it's not final. We need to dig in further. Of course, you need a fertility specialist. Very important. We normally see people that will go to the lab by themselves. Once they give them that number, they start freaking out. Don't make the mistake of going to the lab to run your FSH, to run your AMH by yourself. Make sure a fertility specialist will interpret your AMH, your FSH, together with other hormonal panel. One-time reading of low AMH and high FSH, it's not a diagnostic criteria that you can become pregnant. So some women can have diminished ovarian reserve and they can still go ahead and become pregnant. Some women might have high ovarian reserve and they can still have infertility. Let me give you an example. A woman in her 40s, mid-40s, that has high level of ovarian reserve might find it more difficult compared to a woman lower than 40 that has low ovarian reserve. Let me repeat again. If you're 30 and you were given a diagnosis of DOR, diminished ovarian reserve, you have a better chance of succeeding in becoming pregnant naturally compared to a woman in her 45 who has high ovarian reserve. So age is a huge, huge factor. So what I will tell you today, if you have been given ovarian reserve to be low as your diagnosis, don't give up. Don't freak out. Let's go deeper. Let's go further. We need to probe further. We need to look at other parameters. We need to look at other criteria, take history, look at your partner, look at you. Then when you're doing all this, the best way to improve your chance of becoming pregnant, if you were given a diagnosis of reduced ovarian reserve, is to do what? To improve on your lifestyle. Unfortunately, there is no drug we can give you to generate new eggs. Once you lose your eggs, it's gone. Now, also, unfortunately or fortunately, every woman is going to have abnormal and normal eggs by default at any age. Now, when you're getting older, you will have more abnormal eggs. So it's a game of, fraction. So it doesn't mean there's a stage you will have everything normal. Age is the biggest player. So at 45, you will have more abnormal eggs compared to normal eggs. At 25, you will have more normal eggs compared to abnormal eggs. So everything is all relative. Now, everything is also individualized. So one woman can have this and another woman can have that. No two people can have the same thing. But the bottom line is to make sure you have someone who knows better. And the best person to help you in this scenario is who? A fertility specialist. There are so many other factors we need to tie together. There are so many other things we need to investigate in the body of a woman before we can categorically say, okay, you know what? Your chances of becoming pregnant by yourself is reduced. Now, here's the good news. So long as you're a woman and you have one egg, that one egg can suddenly get you pregnant. So you still have a chance. There is no impossibility in a woman trying to become pregnant naturally, unless you have gone into confirmed menopause. So long as you haven't gone into confirmed menopause, you can still become pregnant naturally. So whether you were given a diminished ovarian reserve diagnosis or you have high ovarian reserve, continue practicing your PPP. Continue praying, continue playing, and continue practicing. You still have a good chance of becoming pregnant by yourself. Now, in the event we have confirmed that truly you have diminished ovarian reserve and it happened before 40, we've run your test and it's tilting towards primary ovarian failure or premature ovarian failure. It means you've gone into early menopause. Can you still be a mother? Yes. What do we need? Donor eggs. So once we have our diagnosis and it's pointing in line with premature ovarian failure, which we can also glean from the results we will get by the time we examine the female reproductive system, the next best option is to go for donor eggs. Please don't waste the time you don't have, especially if you're 35 years and above. Now, for you to put yourself in a better position, you have to watch what you eat, because what you eat can help you to maintain the quality of your eggs. You have to exercise, you have to avoid smoking, you have to avoid alcohol, you have to reduce your soda intake, you have to avoid stress, because everything I mentioned can together limit your chance of becoming pregnant naturally. So the only way that will help you to become pregnant if you have diminished ovarian reserve is to do what? To reverse your lifestyle. So if you're a smoker, you stop completely. If you're a drinker of alcohol, you stop completely. If you have a lot of stressors around you, you fix them. You keep on doing your best. You keep on meeting with your partner. You keep on making love for 8 hours. You keep on praying. You don't give up, because you still have a chance. But at the end of the day, we need to be sure of what we are doing. This is where a fertility specialist can come in. A fertility specialist is the only person that will give us a diagnosis, and we run with the diagnosis, and we make sure that we are in the right direction. So don't go about freaking out by yourself because you went to the lab and you got the lab result and you start freaking out. Oh, I'm not going to be a mother because I have diminished ovarian reserve. We have seen women who had very poor parameters of eggs. They still became pregnant naturally. We have seen women that were looking for money for IVF, even for donor IVF, they naturally became pregnant. We have seen women that had failed IVF or successful IVF. Now, when they were just trying by themselves, they became pregnant. So the body of a woman can play tricks on us, but the most important thing is what you're doing by yourself to improve your chance of becoming pregnant by yourself naturally. So whether you're going for IUI, IVF, surrogacy, don't stop trying naturally. You still can become pregnant. Very important. But if it's confirmed that you've gone into menopause, or if it's confirmed that your 2 tubes are blocked, please don't waste the time you don't have. Start planning for IVF with donor eggs as soon as possible. So my take home for today is to live healthy. Adopt your healthy lifestyle. Mind what you eat. Whatever enters your body will follow what we call GIGO, garbage in, garbage out. If you eat good stuff, it's going to yield good stuff. If you eat bad stuff, it's going to yield bad stuff. So make sure that whatever is going into your body, it's good. It's of high quality. If you eat your fruits and vegetables, if you drink your water, if you avoid alcohol, everything in your body will function properly, because our body functions as a unit. So very important, 30 minutes exercise, increase your fruits and vegetables, take your prenatal multivitamins, sleep, avoid stress. If you can do all these simple things, the beautiful thing in reproductive health is the fact that simple things lead to big things. Sometimes you are looking for one particular drug that will do the magic, but the magic is enough. So everything is related to how you value yourself, how you live your everyday. Some people might not be drinking alcohol, but they are binging on soda. Soda and alcohol are the same thing. You don't need it. Embrace your water. They will damage your body over the long run. Okay, so that's my quick presentation on this important topic. And now I'm going to open the clinic to take care of your questions. So if you have questions, please feel free to ask, and I'll provide you feedbacks in real time. For some reason, sometimes the questions are not visible to me. So if I didn't see your question, I haven't seen it. Okay, but if you have an opportunity, please put okay, my COO's question is on. Can a woman with diminished ovarian reserve still menstruate regularly? Yes. Now be very mindful. The fact you went for test and we noticed you have diminished ovarian reserve doesn't have anything to do with your bleeding and regularity. Some people can have that together with irregular bleeding. Some people can have it independent of their bleeding. So you can still be bleeding normally, 28-day cycle, bleeding for 3 days, bleeding for 4 days, but your reserve is low. You might not even be bleeding at all, but you have a good reserve. So the common denominator in trying to become pregnant is to continue. Because once you release your eggs, you're going to become pregnant. So don't always focus on if you are bleeding or not. There are some women that will be having what we call an ovulatory cycle. You are bleeding, but you're not releasing egg. And some women will not even bleed at all, but they have released egg. This is what happens when you are newly delivered of a baby. You are waiting for your period to come back and suddenly you're pregnant. So very important question. asked by my COO. Okay, is diminished ovarian reserve same as premature ovarian failure? So here's the deal. Both of them can actually be used interchangeably, but they are two different things. So when you have premature ovarian failure, it can present with diminished ovarian reserve. So there are a couple of things that can lead to premature ovarian failure. It might be genetic, it might be environmental, you might have had cancer, and because of treating cancer, we damage your ovaries. So anything that will affect your reserve, that will lead to early menopause, will present with diminished ovarian reserve. So let me give you an example. If you got exposed to certain things that damage your ovaries and your ovaries are no longer able to lead to the normal process of ovulation, when we run our numbers, when we check our FSH, when we check our AMH, when we check our estrogen and a couple of other hormones, the numbers are not going to add up. So that premature ovarian failure will present with what? Diminished ovarian reserve. So for us to know you have diminished ovarian reserve, we need to look at the numbers. Very smart, important question by Kenneth. Okay, guys, keep asking your questions. If you know anybody that will benefit from this topic, please share the topic with them. Then afterwards, please find time to subscribe, like, comment, share. Now, if you're in YouTube, this is our clinic. We run it every Tuesday and every Saturday, okay? Now, if you're in YouTube, if you're in Facebook, we have a page, we have a group, we are in Twitter, we are in Instagram, so we are virtually everywhere. We recently also started in TikTok. Okay, so you have every opportunity to learn on a daily basis. But right now, let's keep talking. What first result indicate that a woman has diminished ovarian reserve? Two tests, but they are not perfect tests. FSH, follicular stimulating hormone, and AMH, anti-Mullerian hormone. When your FSH is relatively very high, based on the range we want, and your anti-Mullerian hormone is low, so low AMH, high FSH will indicate that you have diminished ovarian reserve, but they are not perfect tests. Sometimes they might not be the best way to predict. So sometimes you can have all the clinical presentation and the numbers are not adding up. Sometimes you can have a bad lab report and your clinical presentation is good. So those are actually the two criteria we normally use to check, but they are not perfect tests. So what do I mean by perfect test? Once you have any of them, it doesn't mean you cannot or can. So it's a neither here or there kind of thing. So women that have diminished ovarian reserve can still go ahead and become pregnant spontaneously without any help, or they can still have difficulties because there are so many other factors that will play a role before you become pregnant. Okay? All right. I love those two questions. So please keep on asking your questions. It looks like it's only one person that is around. If you're out there and you need to ask questions about this topic, please feel free to ask and I'll provide you feedbacks. We'll round up in 20 minutes. So in 2 minutes, we'll round up so you can go and get some rest. Okay? All right. So please have your game plan in 2022, which will warrant you to pray a lot, make love with your partner, and practice. If you can combine these three things, then your possibility of becoming a mother in 2022 is very high. All right? Okay. Do you still have any questions? If you still have questions, you can feel free and ask. I'll provide you feedbacks. All right, guys. Thank you for coming. Remember, today we are looking at how to become pregnant with diminished ovarian reserve. Diminished ovarian reserve means the quantity and the quality of your eggs are actually reduced. So here's what I will tell you. If you're planning to go for assisted reproductive technique, it's always advisable to start living healthy 3 months before you actually start. So let me give you an example. If you're planning to start IVF in March, you would have started living healthy from January so that you can get January, you can get your February, then by March you're ready. So what do I mean by living healthy? Watch what you eat your fruits and vegetables, exercise, 30 minutes daily sleep. The reason why you need to do this is to make sure that your body is in a good place because your body functions as a unit. So always do your best. Always make sure you have good BMI. So BMI means body mass index. So if you need to drop some unhealthy body weight, you drop your unhealthy body weight. If you're not sleeping properly, you make sure you're sleeping properly. You drink your water, you eat your fruits and vegetables. Then importantly, you take your prenatal multivitamins. If you can do this, you have checked the box of personal preparations before you start in March. Don't be in a hurry to spend a lot of money for a process that is complex, that if we don't do it carefully, it can fail. IVF succeeds, but it's something we need to plan properly before you proceed, okay? Very important. What's the best way forward with diminished eggs, okay? Now we can start with IUI, okay? The reason, actually, let me make it simple. If we are dealing with eggs, once your eggs are compromised, the only route to go is IVF. If we are dealing with the sperm, we can actually go for IUI and IVF. But if we are dealing with the eggs, because your eggs are going to be released from the ovaries, so first of all, it has to come. So if we can't get the eggs, we cannot handle the eggs outside. I don't know if you understand my explanation. But if it's sperm, we can use sperm in IUI. What do? We inject the sperm into the womb, or in IVF, we use the sperm outside the body of a woman. We join in with the eggs, and we have a good outcome. So the bigger picture, the best option for a woman that has diminished ovarian reserve is to do what? To use donor eggs. And if you're going to use donor eggs, then you're going to go for what? IVF or surrogacy. If you're going for IVF, it means you are going to use your womb, we are going to use your partner's sperm, then we are going to use some other person's egg to get you pregnant, then we transfer the baby into your womb. If you're going for surrogacy, it means you're going to get that partner's, that helper's egg, then get your partner's sperm, then use another woman to have your baby. Okay? So those are the options available to you. The best option for diminished ovarian reserve is donor eggs. You go for IVF. Okay? All right. Please, for SBPT, your question is not clear. Please, if you have any other question, ask before I go. Okay? Are we all clear? All right. Okay. I want to believe we're very clear, and we have to put in more efforts. Now, if you are intending to be a mother in 2022, if you are intending to be a father in 2022, we have a special event on the 30th. We normally select one topic and we run a masterclass on it. This is an opportunity to start your new year on a fresh note. The best way to start is to start immediately. So we have a special event on the 30th. Make sure you go and register. Register on time. Come with your partner. Tell your friends so we can fellowship. We have 3 subject matter specialists. We're going to take time to deconstruct female infertility, male infertility, then we proffer solutions so you can begin early to begin to seek help in regards to starting your family. So please make sure you register, okay? We have all the links in Facebook, we have in Instagram, we have in a couple of other outlets, in Twitter and in TikTok, okay? So find any of the links and make sure you register. When you register, shoot us an email. So we'll give you a link so you can join the special group. We have limited slots, so I will encourage you to register on time. Okay? So the next time I will see you guys on YouTube is going to be on Saturday. Thank you for coming and enjoy the rest of your evening. Bye-bye for now.